This is FX Radio. I'm Andrew Whitfield-Cook. With me in the studio today are two people, Danny Urbinder, the Education Manager of BioCeuticals, and Dr Mark Donohoe, who will be emceeing the 2015 BioCeuticals Symposium in April. And I welcome you both to the studio just to have a brief chat about what practitioners can expect from the symposium. So welcome, Danny and Mark. First question is, what can practitioners expect that's going to be different from the previous symposium?
This is really exciting because really what came out of the last two symposiums, while we certainly had some brilliant feedback and it's been so well received, we had the good fortune of actually bringing Marc Houston over last year. Marc Houston is probably the leading integrative cardiologist in the world. And he's quite a unique personality. He takes his profession well beyond just his clinic. He is a passionate educator. So we had the good fortune of actually having several dinners with Marc, and out of that came some ideas about really how we can improve, how we can actually, I suppose, make this into a really educational experience for practitioners. So rather than having individual researchers presenting their areas of research and their key areas of interest, we're going to bring together some practitioners that are very well versed in their areas of research, but they're also clinicians, and they're going to be talking together and starting to piece together their various disciplines to create really a holistic model of health. So we've developed something that can really follow those guidelines and really give something of value to practitioners that actually attend.
I think one of the things that these specialists in their own areas are going to bring is a holistic approach that's going to blend everything together, but also giving people the confidence to treat people when they present with a certain symptom. And Mark Donohoe, you do this all the time.
Yeah, I think the opportunity this year is you go deep into areas that are of vital clinical importance in practice. Neurology, inflammation, the gut, toxins, and the cardiovascular system covers a lot of big areas with really high quality, deep information. The practitioner gets a chance to immerse himself or herself in that process and come out with the masterclass kind of graduation from it, that you know deeply how to manage four very important areas of practice from the best minds that I know of.
So, Danny, it's going to take a little bit of a different format from the previous symposiums, isn't it?
Yeah.
You're going to have workshops as well.
Well, we're going to have workshops, and we did have workshops at the last symposium, but these are going to take, I suppose, a slightly different direction. I think the important point to make, and this is following on from what Mark said, is we're going to have less speakers this time. So in the past, we had maybe 10 or 12 speakers, and they each spoke to their particular disciplines. This time, we're going to have 4 speakers, and we really want to allow them enough time to go into that depth that Mark was speaking about. And the beauty of having 4 speakers as well is that while they might be all over the planet, they're talking to each other right now. So they're really, at this moment, working together to create a cohesive program that will allow for anyone that attends to really walk away with a comprehensible model of health and wellness. So we're allowing longer plenary sessions, so they're really going to go for 100 minutes plus question time. And this is really, and this was negotiated, to allow the speakers the amount of time they really need to do their topics justice, and then to allow enough question time at the end as well. So this really gives a level of depth so that when you go into the workshops, and these will be hour-long workshops, it will give you the foundation then to really sort of give attendees the opportunity to then really explore, how am I going to use this in practice? What type of patients am I going to see that I can use this information on? So they're going to be using what's called the iterative method, and they're going to say, right, we've just covered this area of information. I'm going to just shoot some very basic questions at you. Here is a patient presenting with such and such. You ask the questions, and I'll guide you. So this is a very effective way of really consolidating all that information into a practical, workable knowledge.
So this is going to be, as we've spoken about, 4 key areas of practice. You're going to have neurological, gastroenterological, toxicity, and cardiovascular issues.
That's right.
And the practitioners, the delegates are going to be able to bring their conundrums or their fears, their concerns to these workshops and have them answered.
Absolutely, yeah.
And each practitioner gets to go to every workshop. Unlike last year, there's no you miss out on one by going somewhere else.
Yep.
Cycling through it means everybody goes through the same process, and the depth is not missed. You don't miss out on cardiovascular disease because you wanted to know about toxicology. You cycle through that, and I think that's critical. The practitioners last year had lots of questions, providing a framework for them to be able to have those questions answered with the expert in front of them. I think that's a critical difference.
So the workshops you've got 3 workshops running not concurrently but at different times, so each workshop is going to have a smaller amount of people.
Yeah, that's right. So we're going to split the audience up into 3, and the speakers are going to be visiting each audience or each smaller group, and they'll just be swapping around each session. So basically, in terms of logistics, it certainly works out better, but it just gives the audience, the attendees, an opportunity to listen to each of the speakers, and they get to hear all the workshops.
And Dr. Marc Houston, I mean, he's just a master of bringing in the holistic approach to tie in everything. He did this so well last year with Lee Zalter's talk on cancer and his on cardiovascular disease. And he said, you know, I could drop in cardiovascular disease to your slides and be talking about the same subject.
Yeah, and
really interesting.
That's where his genius lies. And Marc is very much driving this process. So it's not just plenary sessions and workshops. There are also panel discussions, and these aren't question and answer panel discussions. These are, by day 3, we've covered a lot of ground. How are we going to tie it all together? And each of the speakers I suppose, have a role to play in putting together what is a functional medical model. And, you know, we've got an explosion of research out there at the moment, and people are being inundated with so much new information. As exciting as it is, it's very difficult to piece together to create a holistic model of medicine. That's what these speakers are going to be doing, and Marc is driving that process. He's such a master at that.
Absolutely agreed. What I love about the speakers, though, is that they're really at the top of the game. You know, you've got Joe Pizzorno, who is a founder of Bastyr University, and his specialty is toxicity. The conversation I had with him about really new things that we haven't thought about driving toxicity.
Yeah.
Key, and I think it's going to answer so many conundrums that practitioners have experienced previously.
Yeah, and I listened to your audio interview, I think it was last week, and he certainly raised some interesting points. I mean, even things like diabetes, and he actually put forward that he would take a bet that so much of the diabetes that we see these days is actually related to toxicity. And certainly, you know, we're talking about receptor interference due to the toxins that are floating around in our environment, interfering with insulin receptors. I don't know if that's your experience, Marc, and your observations.
It is, and not just that. We need a way of tying endotoxins, exotoxins. We have to stop thinking of as all poisons being from outside. Plenty of the time we're generating it ourselves, get a leaky gut, and now you've got a membrane problem, an immunological problem, an inflammatory problem, a cardiovascular problem. That's the magic of bringing these guys together. Bringing that kind of continuity of thought and underlying processes is exactly what Marc Houston showed he could do last year. So him driving the process, I think, will force all of the presenters to think, how do I tie into the process of the ill patient? And that's what I see the benefit for the practitioner.
Marc Houston mentions, hypertension being a finite response to an infinite amount of insults. And one of the other speakers, Mike Ash, he's an absolute specialist in gastroenterological conditions, and he's got a real knack with treating behavioural disorders in the UK. Indeed, he's a leader of a group over there. Was it Nutrilink? Yeah. So tell me a little bit about what Mike Ash is going to be bringing for the delegates.
Well, I think that Mike Ash, and for some of the listeners, they might remember when Mike Ash first came out to Australia. It was actually BioCeuticals that brought him out. I think it was about 10 years ago.
He was like a sledgehammer to my brain.
Well, to everyone's brain, because I'd never heard anything like that.
Yeah.
So he really was the one that, for me, showed how particularly the gut microbiota can influence the immune system, can influence inflammation, and certainly by extension we're talking about mood, we're talking about cardiovascular health. So Mike Ash is really at the foundation of this talk. Certainly Marc Houston's driving the process in terms of bringing these speakers together. But when we talk about gastroenterological issues, these are the things that are primarily driving inflammation. They're primarily driving our immune dysfunctions. So I think that's really the foundational concept that he's going to bring. The difference between 10 years and now is we just have an absolute explosion of information coming at us. And he's able to really tease that out and to put it into a comprehensible format so that we can walk away without being too overwhelmed. And I think Marc Houston does this so well. So as complex as his information can be at times, he always brings it back to the basics. And that is, there are an infinite number of insults, and there really just are a finite number of responses to those insults. And they are inflammation, oxidative stress, and immune dysfunction. And really, they are the causes of really the most of the chronic illnesses that we see, and that will be certainly discussed by all our speakers as a result. So these are the issues that the speakers are going to be talking about, particularly on day 3 when they have their panel discussions, and how it applies to each of their fields and disciplines.
You're right in saying that they can become quite complex. I've seen Marc Houston's slides when he gets into it. But what I like about all of the speakers is they take these really, and they can be exceptionally complex conditions and factors involved in them, but they round them off and they say, this is how we treat.
Yeah.
I can't wait to hear Catherine Willner, because I've met Catherine a couple of times over in the States.
The reason we chose Catherine Willner in the first place was when we were working out what speakers do we want at this symposium, what disciplines do we want to represent. Very quickly we decided that a neurological practitioner is very important. There are very few functional neurologists out there, and certainly very few functional neurologists that have the level of expertise and knowledge that Catherine Willner has. And it was Marc Houston that, I mean, he was almost militant about this. No, we have to have Catherine Willner. Yeah. And I've certainly briefly heard her do some interviews, and in our discussions via email, I've seen some of the things that she wants to talk about, and it does cover those areas that you mentioned. But I'm interested to hear what you think. Or what we can expect from Catherine Willner, because you've actually seen her, haven't you, in the States?
A couple of times. And she really does round off these neurological disorders. She's very heavily into the pathophysiology. She explains quite technically the issues that's going on. But she rounds off the treatment. And this is the thing, when you're looking at a clinician, not just a researcher, but a clinician dealing with these patients every day, you come up with the conundrums. What happens when this happens? Or when this doesn't work. And Catherine Willner answers those. So she'll be giving some answers to the delegates, I think, that will surprise a lot of people.
And it turns out, I mean, neurological responses are what we doctors have to deal with. People and their response to stress, to inflammation, to their immunological alterations, it plays out in the brain, presentation, mood, emotion, behaviour, memory. The very reasons that people turn up to doctors are how their brain is working at the end of that long chain.
If I could give one piece of advice to the delegates is don't come tired. Their brains will be full. They are going to learn a heck of a lot. Yeah. This is not a light little introduction symposium. It's going to be practice changing things.
No, and look, you said symposium, and that was what we called the first 2. And we're still continuing with that title, but really it is a masterclass. This is a 3-day intensive masterclass where the speakers, I mean, they're just so excited to be able to have this format, this forum to speak at. It's not just an hour session and they leave and, they feel like they've just done that same old routine over and over again. Here they really do have an opportunity to get into the depths that they're so passionate about. And these are all teachers, they're keen to teach. I think that maybe in the past their frustration lay in the fact that they didn't have the opportunity to teach properly, to go into that level of depth that really will convey the information to the delegates in a way that they can piece it together and feel like they can apply that in practice.
Yeah, and from that comes learning. And to me, the big deal at the end of it is confidence. Practitioners are going to feel confident in treating these patients, because in the end of the day, you want to know that you're doing the best possible job for your patients. It's their outcome that is the overall answer to me.
And from a practitioner perspective, the best use of specialists we can have is for them to start talking together and producing that integrative approach. Too often, specialists live in their own little kingdoms. They don't talk. There's no relevance to general practitioners or to naturopaths. getting them to work hard to tie things together and talk to each other, that's an achievement all by itself.
Dr Mark Donohoe and Danny Urbinder from BioCeuticals, thank you so much for joining me in the studio today. I'm really excited about next year's symposium. I know you are too. So I really look forward to seeing you and indeed the speakers there.
Thank you.
This is FX Radio. I'm Andrew Whitfield-Cook.